I'm going to explain about a treatment for trigger points. Now, those of you who have looked at my other videos, there will be a much more full explanation of what a trigger point is. There are also a number of different ways to treat, and this one is called a torsional release. It's an elegant and beautiful treatment that you can learn to do on yourself, and if you're a therapist, you can learn to do for others or on others. I'm going to show you my arm because trigger points are really common in the forearm, and especially in the muscles that extend the wrist and the fingers. So there's a group of muscles on your forearm, and the way that you find the trigger point is it's a little area which has gone into protective spasm. When it goes into protective spasm, it causes a tight band in the muscle. So the muscles run along the arm, and therefore, as you start to feel, you run your hand over and you're searching for these tight little bands which feel like a little guitar string. So as you come across, I can feel I'm jumping over a little band right here. Once you've found a band, then you move up or down it until you find there's a little thickening, and then it's sore. You think, ow, oh, okay, that's sore. That's a trigger just there. Now, the trigger points, as has been explained, is that the trigger point acts like the trigger of a gun. So often you feel pain where it is, but you may feel pain that refers. And the trigger points from here refer to your wrist, to your hand, and to your fingers. You may be feeling pain in this area, and your doctor looks at it and says, oh, I don't know, I can't find very much here, and doesn't look up to where the trigger is. So I found, there we are, I'm bumping, move, oh, there I've got my trigger. So now that I'm on the trigger, I've got a finger on the trigger and I've kind of pinned it. Then I put another finger there, and if I push harder, ow, it hurts, and I feel a little sort of twingy thing appearing in my wrist. So this is an active trigger that I've got here. Now, the way I'm going to show you to treat this trigger is that the first thing that you do is you slowly lift and rotate your arm. So you're twisting your arm and lifting your wrist just very gently. And what you'll find is an amazing thing, that as you torsion your wrist and move it around, suddenly, oh, there it is. I found a spot where it doesn't hurt. This is by doing these subtle movements. So I'm moving my wrist up and down. In fact, here I have to drop my wrist slightly. I'm rotating it a wee bit, and there's the spot. And I can press as hard as I like. Oh, if I press really hard, it hurts, but much, much harder than I had to before. So this is this magic spot that you find with the torsional release. My finger is on the trigger. It's no longer very uncomfortable because triggers can be exquisitely sore. And I can now practice breathing. So I just relax, I breathe. My hand is in a position where, there it is again, where my trigger isn't hurting, but I'm pressing on it. Now, as I start to press on it, what I start to do is actually deactivate it. Now, as I push a little bit harder, I'm breathing, I'm relaxing, I'm staying below the pain threshold, and I'm pressing quite hard now. I'm relaxing my arm, I'm relaxing my breathing, and there, now I can push as hard as I like, doesn't seem to hurt. Now at this point, I can start to rotate or lift my arm, and I start to activate the muscle. As I activate it, I'm pressing quite firmly, I'm feeling for pain. Oh, that hurts. So then I come back just a wee bit. So I've gone into pain zone, I'm back out of pain zone. I just relax a wee bit. There, that's very comfortable. I come back again, I breathe out, and then I rotate a wee bit more. Oh, actually, I can get further now, which is what happens with this torsional release. Okay, so now I'm here to there. Now that's starting to hurt. So now I relax. I come back into the comfort zone. Then I just move again, lift my arm up. Oh, now I'm actually getting a lot more movement without pain. And then here, there. Oh, it's actually released. So if I press as hard as I like, it doesn't hurt. So there you are. I've done a torsional release on the forehand, on a trigger in my forearm. And so I'll just go through those principles again. You find the trigger point. Once you find it and you press on it and it's sore, okay, you then rotate the joint, whatever it is, you rotate or extend, and because the wrist can do both rotation and extension, and it can move around many, so it's a multi-directional joint. You find the angle at which this becomes not tender. Once you've found that, you relax and you breathe, and then you slowly, and you relax, you breathe, you build your pressure until you can push as hard as you like, and the pain is gone here, and then you gradually start to regain your range of movement. As the pain starts, you go back into the zone of comfort. You breathe and you relax. You go a little bit further. Oh, that's sore. You come back. You go a bit further, until it's released. And this is a mixture of pressure, which is ischemic pressure on the trigger, turning it off, and getting you a nice, free, pain-free range of movement. A very nice, elegant, the person who can do it best is you. You can do it in your neck. Just find the angle at which, the pain goes, and then gradually increase that range of movement. You can do it in your back. And again, shift around. You can do it in your butt or your hip or your knee. Anywhere you can do the same principle applies. So there you go. A nice, elegant technique you can do on yourself or you can do on patients. If you are doing it on patients, you can teach them to do it on themselves. It's as with a lot of my treatments of trigger points, it is comfortable. For it to work, you need to find that wonderful zone where there's no pain, and then gradually encroach into areas of pain, but always coming back, relaxing, going a bit further back and back until the pain is gone completely. And when it's gone, it is gone. You've turned the trigger point off and you've inactivated it so that you can now have full range of painless movement. Very exciting. If you enjoyed this video and you felt that you've learned something, please click the link below to subscribe, and then you'll get all my new videos, and you'll be able to know when they come and enjoy those as well. Thank you all very much for listening.